Colon cancer is probably the third leading cause of cancer in the whole of America, and definitely it's the same in West Virginia. Colon cancer is preventable, treatable, and beatable if diagnosed early. People as they get older, particularly after 50, we recommend them to have a colonoscopy, which is a gold standard. If they can have a colonoscopy, that's a gold standard. But many people hesitate to have, or because of a lot of different reasons, a lot of different barriers. They're scared of the preparation or scared of the procedure, or they had somebody else who had some issues with that, or they're scared to find out their diagnosis, so they don't want to have it. So alternatives are stool tests. There's a plain straightforward stool test, which they can do it in the doctor's office. It doesn't cost them much at all, and it is easy to do. But it's got some disadvantage that there can be some false positives. So there are other stool tests where currently they have something called Cologuard, where they send it in the mail, they collect the stool sample, send it. There's another one called FIT test, where they check the stool in the doctor's office itself. It's another card. Usually if we do these sort of stool tests, which is cheaper, easier to do, at least you're one step. In a sense, if they find that there is any blood in the stool, or the stool test comes positive, then they have to go for a colonoscopy. The colonoscopy as such is the ultimate, where they look for any small polyps, which can be precancerous, and they can treat it. That's the stage where you can treat. Every human being is at risk of colon cancer. So according to the Cancer Society, 1 in every 22 men and 1 in every 24 women is at risk of colon cancer through their lifetime. The more older they are, the family history of colon cancers or polyps, people who already have a diagnosis of Crohn's colitis or ulcerative colitis, they are at higher risk of colon cancers. If they are smokers, anyone who has had a previous diagnosis of polyps or cancers, even though they are treated, they already are at higher risk. So anyone over 50, definitely. Anyone with a family history, we can consider doing it earlier based on their situations.